Welcome back. In this video, we'll talk about the potassium effects on the ECG, how hypo and hyperkalemia affect the heart, what are the symptoms, and how we treat them. We'll start with hyperkalemia, and this can be subdivided into mild, moderate, or severe. Mild being from 5 till 6.5, moderate being 6.5 till 7, and anything more than 7 is severe. In the ECG, mainly in the mild state, look at the T wave being tall or tinted in shape. A T wave that looks like a tent is a sign of mild or some state of hyperkalemia. In moderate case, the PR interval can be extended, and the P wave itself can be reduced and almost flattened. And if the QRS complex is affected, especially if it was widened, this indicates severe hyperkalemia. So to put it simply, T wave is affected in mild state, P wave is affected in moderate state, and the QRS complex, which is the big one, is affected in the severe state. The main causes of hyperkalemia are of course kidney problems, because potassium has a very narrow window and it should stay in this small window. If it increases or decreases, we will immediately have symptoms. And so the kidneys can filter out potassium very quickly and very efficiently. So, patients with hyperkalemia are expected to have some problems in the kidneys, either being acute or chronic kidney disease. Either one of these cases can affect the potassium levels. There are also some medications, especially diuretics, that can affect the levels of potassium. Our cells naturally have a lot of potassium inside. Think of a cell as a banana in the sea. The banana has a lot of potassium and the sea has a lot of salt. So our cells have a lot of potassium inside, and the fluid around them have a lot of sodium. So when we have tissue injury that damages a lot of cells, will cause all of this potassium inside the cells to leak into the outside environment. And this can cause hyperkalemia. We see this in crush injuries, in burn victims, or sometimes in rhabdomyolysis. It's also a sign of tumor lysis syndrome. Again, hemolysis or anything that causes widespread breakage of the red blood cells can also cause the leak of all of this potassium, and this can increase the potassium levels. And transfusion of stored blood. If the blood was stored for a long period of time, all of the blood cells can break, and this can cause the release of the potassium within the blood cells into the around environment. The first sign to develop is palpitation, where the patient feels that their heart is trying to get out of their chest. It's simply defined as feeling the heart rate, shortness of breath, chest pain of course, and some other vague symptoms like vague abdominal pain, feeling unwellness, generalized nausea or vomiting, and other vague symptoms, but mainly palpitation and chest pain. As soon as you see hyperkalemia, especially if it was more than 6.5, you should immediately give the patient calcium gluconate. Before correcting potassium, before doing anything, just give the patient calcium gluconate, as it will stabilize the heart and prevent the inevitable arrhythmia. If you don't correct it very quickly, which you cannot do very quickly, the heart will go into arrhythmia, and we can stabilize the heart by calcium gluconate. So after you give the patient calcium gluconate, then you can correct the potassium very slowly as you like. We can either use insulin with, of course, either D5 or some sugar. We can use beta agonists or some like salbutamol or anything else. And now let's talk about hypokalemia. Again, hypokalemia can be subdivided into 3 categories, either 3 to 3.5, and this is the mild form, 2.5 to 3, and this is the moderate, and anything less than 2.5 is a severe hypokalemia. In the ECG, look at the U wave. A prominent U wave indicates symptoms of hypokalemia. You can also see PR prolongation, ST wave depression, flattening of the T wave or sometimes inversion of the T wave, tachycardia, and sometimes torsades du poids. To simply know the causes, think of anything that would cause wasting of our body fluids. So mainly diuretics, which are literally medications that cause wasting of the fluid, excessive vomiting or diarrhea, kidney problems, excessive sweating, and magnesium deficiency, as magnesium is very important in controlling potassium level. In fact, If you try to correct potassium level and it does not correct very easily, you should check magnesium levels. And this is a very important note for exams. For the symptoms, look at weakness, feeling tired or muscle cramps all over, confusion, sometimes constipation, and tingling around the fingers or nails. Hypokalemia is simply treated by giving the patient potassium. This is mostly done intravenously, but it has to be done very slowly. Potassium is a very strong irritant to the blood vessels. So if you give it intravenously in large volumes, it will immediately cause phlebitis, and it can cause actually obstruction of the blood vessel. But you can give it intravenously as long as you do it slowly. And if you see some ECG changes associated with hypokalemia, you should also consider giving the patient calcium, as it also stabilizes the heart. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.